Thank you, Mr. Chairman, for holding a hearing on this important subject, and thank you, members of this panel, for sharing your views with our committee. I believe it is absolutely critical that the VA adopt policies to meet the needs of our nation's growing number of women veterans. The rapidly increasing demographic shift of the American veteran population is really quite stunning. The number of women veterans using VHA between 2003 and 2012 nearly doubled. 20% of new recruits now are women, while in 2012 it was only 6.5% of VA's patient population were women. To address this dramatic shift, last month I introduced the Women Veterans Access to Quality Care Act. The bill requires the VA to ensure the availability of OBGYN healthcare services at all VA medical centers, to improve its healthcare facilities to meet the needs of our women veterans, and to hold hospital directors publicly accountable for women's healthcare outcomes at their facilities. I'm thrilled that the Vietnam Veterans of America signaled its full support for my bill in its statement for the record submitted to the committee today, and I look forward to working with all of you on the panel as well, and with my colleagues on the dais to make sure that we get the bill right and ensure our women's veterans are getting the health care that they deserve. And I invite all my committee members to join me in this effort. Ms. Augustine, in your testimony today, you noted the survey conducted by the Iraq and Afghanistan Veterans of America that found 56% of respondents felt that the VA provided an adequate number of women practitioners. Only 41% believed the VA provided an adequate number of doctors specializing in women's care, and only 34% said the VA adequately provided specialized facilities for women. Do you think that VA's current policies to place, quote, designated women's health providers, unquote, is adequate to address the needs of your membership?
Based on what we're hearing from our members, like you read in our new survey, which is updated data, there is still a population that is being underserved in those needs. We know that the VA is doing their due diligence to try to meet those needs. What we're hoping to see is that it is done quickly, that there is adequate staffing levels to meet the demand so that there aren't situations like we've heard about this morning, and that moving forward, the increasing number of women veterans, particularly the younger generation coming in, that increase, is getting the services that they need in a timely manner.
Okay, and thank you for your service as well. Ms. Halfacre, and thank you for your service to the United States Army as an MP. Was that in Iraq?
Yes, sir.
Do you think that the VA's designated women's health providers are adequate given these figures?
I would say no.
Okay. In 2010, the GAO found that VHA was not complying with its own privacy policies for women veterans. For example, check-in areas were in busy mixed-gender areas. Gynecological exam rooms did not have adjacent restrooms, and examination tables were facing entryways. And anybody in the panel, based on your personal experiences or based on the feedback of your membership, if GAO did the same review today, what would they find?
I can speak to a member I talked with last week. It said that exact same thing. The women's clinic in her local medical facility was located directly next to the pharmacy, right next to the front door. It was always busy. In fact, there was people from the pharmacy who then came into the women's clinic because there was no longer seating available in the pharmacy. So there was certainly a lack of privacy that she shared concerns with.
Okay. Yes.
I would just say some of the infrastructure issues that are throughout VA, have especially impacted on women's health with these safety and privacy issues. Many of the facilities had very small locations for their women's clinic initially. They've been moved around a lot, and being able to put in for construction and infrastructure changes, has a slow process, as you know, throughout VA. So I think that's been a problem, an overarching problem for women's health clinics.
And so I would just say that that was my experience about 2 years ago at the DC VA Medical Center, which is the only place that I've gotten care at the VA. But now they've built a new state-of-the-art facility that does not have those issues and is adequate.
Then, Mr. Chairman, I yield back.